our members. There are no limits on the hearing aids that are offered to you. You can get one pair of hearing aids every 3 years, or two hearing aids if you only need one every 3 years. And that was part of negotiations in recent years in order to, again, be able to continue to afford that great benefit for our members. S. Kravisky, you are asking the magic question in the chat box here. What do the CBAC 2027 negotiations have as an impact on your healthcare benefits? If we knew the answer to that, we would be putting it up on banners and letting you know. While discussions have just started with the parties regarding the CBAC 2027 negotiations, nothing has been decided as of yet. What I can tell you is that historically, there have not been any changes to the retiree healthcare structure with any bargaining agreement that has come through. I know that it is the labor and management view that for those that have retired, you have retired with an excellent benefit package and with the understanding that you have an excellent benefit package. There is no intent on changing any of the coverage for those that exist today. It is very likely that any changes that come through as part of that CBAC negotiation will affect new retirees, possibly, but most likely active employees.
Hey, Ray Ellen, I know a lot of our members are out of state. We have over 12,000 members, but a lot of folks were concerned when they received letters from Yukon Health saying that Yukon was leaving the Aetna network. Would you speak on that a little bit?
Absolutely. So not only did you receive a letter from Yukon Health, you also received a letter from Aetna. And just to make it more fun, you also received a letter from our office as well. Now, keep in mind, our plan is what's called an ESA PPO. We like to speak an acronym and an alphabet. That is an extended service area preferred provider organization. That means that providers that are out of the network can still be paid and can still see our members regardless of their network status. Now, our office has met directly with the individuals at Yukon, and they have assured us that they are going to continue to see State of Connecticut members. So that letter that you got from our office, from the State Comptroller's office, if somebody at the front desk hasn't gotten that message and isn't quite sure, I want you to hand that to them as your proof of that. You are able to continue to see your providers at Yukon Health Center, regardless of their continued network status. There is no break in service for you, no rescheduling of appointments or procedures. You can continue as you were. One thing I want to hit on for us too, actually, I'm very surprised this hasn't come up in the chat as of yet, is with regard to Medicare reimbursement. So we know that the federal Medicare notices have gone out to individuals. There was quite the hike this year in the overall Medicare premium. It is jumping from approximately $180 per month to $202. So quite the jump. Now with that, the state of Connecticut will automatically update your reimbursement if you're getting that standard rate. If you're being charged more than the standard rate because you're considered a high earner by the CMS, Center for Medicare Services, you will need to update us so that we can reimburse you appropriately. You will continue to re-up with Aetna. You're going to send in the documentation to Aetna, and they'll provide the information right back to our payroll system so that we automatically reimburse you at the appropriate rate. The notices from Aetna advising as to where to send everything are in the mail and en route to you. The feds were faster than we were in pushing the go button on getting that information out to you. If you'd like, what I can do is I'll post in the chat box here the information as to where you can send that info. Our office has received a number of calls from folks concerned that they've gotten those notices from Medicare before hearing from us. But just rest assured, you'll continue to get reimbursed. And as I mentioned, if you're receiving or being charged the standard rate, you don't have to do anything. It's only if you're being charged a rate other than that standard value.
I see a few questions in the chat that I can take. Just lost my place. There's a comment that someone received a letter saying Aetna will no longer be providing service in New Hampshire. That absolutely does not apply to you. So this question was regarding New Hampshire, but my response is going to be for anywhere in the country. There are different plans and different service areas that Aetna offers for our individual products in different states and in different counties. That does not impact your plan whatsoever. So don't pay attention to that. If a friend is telling you they saw this or they read that and they are not a state retiree, do not pay attention to that. The plan that you have through the state of Connecticut is a national plan. Any state, any county, anywhere in the US, you have the same level of coverage, the same benefits that you would have in Connecticut. So you are absolutely covered wherever you happen to live or wherever you happen to visit, as long as it is in the US. I saw another question. Someone just mentioned the same reference in California. So yes, don't pay attention to anything that is not for your state of Connecticut plan. I've seen a couple of questions on orthotics as well. So orthotics are covered. There is not a limit to that benefit. So you absolutely have coverage for those products.
One other question that's come up in the chat box as well is with regard to Silver Sneakers. There is no change to the Silver Sneakers program. So Silver Sneakers is still available to all of our members. You can join a participating gym at no cost to you.
Now, there was a question saying, asking if they need to use CVS as their pharmacy. Can you
That is not
remind me how that works?
Go ahead.
That is not a requirement. So of course, members are welcome to use CVS, but that is not a requirement. They can go to any network pharmacy. And if members choose a preferred pharmacy, there is a discount on some of your maintenance medications for certain conditions.
Now, Kristen, there's a message in the box here too with regard to the prescriptions and the transition to SilverScript as it relates to mail order. So one thing I just want to note for members is that as long as your pharmacy has an open prescription for you, that prescription is going to remain open. You'll just need to provide them your new SilverScript card as of January 1st. But can you speak to the process for mail order as well?
Yeah, so with mail order, if you are using mail order today, your information will transition over to the new plan. So it'll be, for example, if you have 3 medications and you're filling them today and they have open refills, that will carry over to your new ID number. You'll still need to, depending on the medication, if you do not have an auto renewal set up, you'll still need to, go ahead and order that medication. But if there are open fills, that will carry over. If you're not using mail order, of course, you're welcome to sign up for that and begin using those services. But if you're using that today, that will carry over to your new plan.
And we have a member who is turning 65, not yet on the Medicare Advantage plan. I can tell you that you will automatically transition to the Medicare Advantage plan on the first of the month in which you turn 65. You have about 300 colleagues on the line here with you that have already done so, and we find this transition to be rather smooth. You will then get the 2 cards that are being mentioned here today. Your family members that are not yet 65 or eligible for Medicare are going to remain right where they are. So they're going to get their own cards for Anthem and Caremark coverage, and will continue under the what we call commercial benefit while you transition to Medicare Advantage. Now, for that Medicare Advantage plan, it's developed to match the coverage that you have on the commercial plan. So all of the same services are covered that you have today. All of the same copays that you have today will transition over as well. But if any questions come up on that process, feel free to reach out to our retiree health unit and we'll be able to walk you through that. One thing I want to mention too, while I'm thinking of it, speaking of the 2 cards, it's important that you get those 2 cards. So a lot of you, especially this time of the year, are making your way south and making your way to warmer climates. It's really important that you have your most up-to-date address information on file with us. Our office is a one-stop shop. So if you update your mailing address with the comptroller's office, it's going to update your pension payroll. So if you have a pension check or your pension stubs that come out in January, that will update that address. It will also update your address for your medical coverage, whether it's Anthem or Aetna, and your dental coverage for Cigna as well. If you'd like, I can post a link to the address change form in the chat box, but if you do have an address change that's recent, if you could please submit that to us as soon as you can. We want to make sure you have all of the information you need for January 1st.
Can you talk a little bit about emergency care for traveling out of the US?
Absolutely. So the one thing that is required as far as emergency care out of the US is that if it's somewhere tropical, you must include Kristen and I on your travel plans. Now, following that, should you have an urgent or emergent need, being on the Medicare plan, Medicare will not allow our plan to pay for services out of the country. If it's not a US-based service, it's not under their domain, so to speak. You will likely have to pay out of pocket for those services, but bring those receipts home with you and you'll get those reimbursed to you by Aetna. And again, if you need to send travel itineraries to us, we'd be happy to review and approve those as well. Anything tropical.
There was a question. I know that most everybody is going to receive their 2 cards on time. If for some reason a membership, the Aetna card, the Silver Scripts cards get lost in the mail, what should people do ahead of January 1st?
If you haven't gotten your card by January 1st, give us a call. They are mailing in such time that everyone should receive them. So if you've not gotten it, please give us a call. You are able to go online and print a copy or download a copy if that's something you're comfortable with. But please give us a call if you haven't received it, and we'll make sure we can get another one sent out to you.
We have a question from someone asking, and pardon me if this has already been discussed. They need CPAP replacement parts, and will that be covered under Aetna or SilverScript?
That will remain covered under the Aetna plan. So CPAP supplies fall under durable medical equipment. That will continue to remain under the Aetna plan. So just as you're getting those supplies today, you can continue to do that.
And another person has been having a lot of trouble reaching a person at Nation's Hearing. They say the customer service has been poor, and they're not having luck getting through, so their husband can't make an appointment. Is the phone number still the same, 1-877-225-0137? It says that's the number they were given, but it doesn't work.
That is actually not the correct number. Give me 1 minute and I will paste the correct number in the chat. So I'm going to reply, actually, I'm going to reply to that specific comment with the number. For anyone else that has questions on Nation's Hearing, again, the number will be here in the chat. You can also visit our microsite, which is ct.aetnamedicare.com. Under extra benefits, there is a link to Nation's Hearing, and you can get both their website and the direct phone number as well.
And while we're looking for other questions, can I just say this is a really confusing time right now during open enrollment for retirees. There's so many commercials and people are calling them and they're getting mailers. And we always remind everybody, don't do anything. State of Connecticut retirees don't sign up for anything. And no matter what they're offering, on TV, free food, free paying you extra for your Part B reimbursement. You're not going to get a better plan than this. So ignore everything and always look for the comptroller's insignia on any mailers that you get. If there's no State of Connecticut comptroller insignia on it, it won't pertain to you. Just throw it out.
If I could underline a statement and bold it, Bernadette, that would have been it just there. It can be very confusing. I know sometimes you walk into the pharmacies and you're hit with folks trying to get you to sign up right there or unwillingly just sign up thinking you're getting a discount. While we can get you back onto the State of Connecticut plan, enrolling in any other plan will bump you from our coverage. And they might come with shiny new what look like freebies, but there's nothing that is, it's always too good to be true, right? Those plans also come with deductibles and limited networks and limited coverage and services. I find it hard to believe that you'd be able to find a plan as valuable as this one.
Another thing I hear about at meetings all the time are the phone calls they get from, either for a wellness visit or if they have diabetes or a chronic condition They get phone calls sometimes asking, would you like to have a nurse that helps you with that? Could you talk about these things a little bit as well?
There's a couple of different programs or benefits that folks could be receiving calls for. I think probably the most popular, I'll call it, is the Healthy Home Visit. So each year, we as a health plan are required to contact members and invite them to participate in a Healthy Home Visit. Signify is our partner vendor for that program, and they'll call you a few times to see if you want to participate in that visit. It is an optional visit for you as a member. However, again, we as a health plan are required to contact our members annually. This benefit is intended to supplement the care that you're getting with your providers. Because that visit takes place in your home, sometimes you have a different conversation than you would have in a doctor's office, or you might think of something you forgot to tell your doctor, or by sitting in your home, that nurse practitioner may be able to point out something that could be a fall hazard and help you identify a way to remove that. Those are just a few examples. Again, it's not intended to replace any care that you're getting from your providers. It's intended to supplement that. That is the one that, again, since we have to invite each member annually to participate, that's probably the most common call, and you will get a letter prior to those phone calls. So that's the big one. Other phone calls that you maybe receive could be for different programs. So for example, if you have a chronic illness, you may receive a phone call from one of our care managers, trying to help you, really trying to check in with you and make sure that you're taking the appropriate actions and educating you on some things that you can do to keep whatever that condition is in check. So it's an optional resource. It's a free resource. Again, just someone else that you have at your fingertips in case you could use some of that additional help or support. Those are probably the top two reasons that you'd get a phone call from us. Other things that we may outreach to you for are gaps in care. So if you are due for a particular screening and we don't see a claim for it, or if we identify that you can benefit from XYZ program, you might get a letter or a phone call about that. So I understand there are lots of phone calls that come in these days. Sometimes it's hard to tell if a phone call is legitimate or is a scam, but these are benefits that are part of your plan. They are optional benefits, and all of these are free to you. So we encourage you to participate, but certainly understand if you do not wish to participate, you can let the caller know that you would like to opt out of that program. I see a couple of questions still on ID cards, so let me go over that one more time. So everyone will be getting 2 new ID cards. They have not mailed yet, so you haven't missed anything yet. They haven't gone out. You should be getting those cards mid-December. So a new card for medical and a new card for pharmacy. Make sure that you give those cards to your provider after January 1st. If you are someone that wants to register on caremark.com, caremark.com is our secure member website for your pharmacy plan. You can do that after you get your ID card in the mail. So when you get that Caremark ID card, it'll have a welcome packet with it. That will give you more information on how you can set up a caremark.com account. But again, you have not missed anything yet. ID cards are in process and will be sent out shortly.
One of our members, Mr. Pappy, is asking when he goes to get his hearing aids, is he restricted to only getting the Beltone brand of hearing aid?
No, through the nation's hearing program, there are different hearing aid manufacturers, there are different products. You are not limited to a particular product or a particular manufacturer. So when you are ready to do that and speak with your audiologist or speak with Nations Hearing, they can help you identify what is the best device for you and give you the information on that. But no, you are not limited to Beltone or any other particular device.
And along those same lines, someone asked if Miracle Ear was in the network. I don't believe they are. No.
They're not at this time.
And you were talking about those healthy home rewards. Someone in the chat had asked if there were still going to be the gift cards for doing different activities through Aetna.
Yes, thank you. I saw that and then I saw something else. Yeah, so let me talk a moment about Healthy Rewards. So Healthy Rewards is a program where if you complete certain activities, you can get a gift card. So the Healthy Home Visit is one of those activities. Getting a vaccine is another. Getting an annual physical. There are various activities that allow you to get a gift card. You will get more information about the Healthy Rewards program. The program is actually changing a little bit for 2026 in that the way you access those benefits will be different. So today you're used to having a healthy home visit, attesting that you had that visit, and then you choose a gift card. Then you have a vaccine and you attest to having the vaccine, and then you choose a gift card. With the new program, you'll get what's called a extra benefits card. It's sort of a benefits wallet. That will be a reloadable gift card that you can use primarily at food stores, but also other retailers like gas stations and CVS. Again, you'll get more information about that, but instead of choosing a different gift card every time, it will now be a reloadable gift card. And where you're able to use that gift card is primarily focused on healthy food options, nutritional options, places where you can get, it's again, primarily focused on healthy nutrition, but also gas stations and some other vendors. So you'll get more information on that program. But yes, the benefit, the Healthy Rewards benefit is absolutely still included.
Ray Allen, would you be able to address the question, the concern that available options for in-network providers for the dental plan is shrinking, and how these negotiations are handled, and if there might be any changes to that to, I'm not seeing the whole question, but if you could talk about the dental plan a little bit.
Absolutely. So was the dental network shrinking? Absolutely correct. It was. The reason that the dental network was shrinking is because with our basic plan, providers were able to bill any value that they wanted to, whether or not they were in network, and get reimbursed that amount. So in doing so, they were upcharging in some cases the plan and costing boatloads of money for the same services as other individuals. And they kind of picked up on the game that they realized I don't have to be in network and I can charge whatever I'd like and I'm going to get paid that. We started to see a shrinking of the network and we started to see an increase in the overall cost. In most cases, it wasn't a dramatic increase, but in some cases, it was quite dramatic. For example, we were seeing what would have been a $100 cleaning coming in at closer to $500. So fully taking advantage of the state's plan design and doing that. So this past July, there was an update to the dental plan to encourage providers to join the network. So the reimbursement for out-of-network providers was reduced in order to get those dentists to the table to hopefully negotiate to come into the network. What we've seen has been actually very impressive. We were kind of, on the line, is this going to work as well as we hope it will? And we're starting to see that it is. Typically, we receive, or not we, but Cigna will receive a number of communications from providers monthly telling them that they want to drop from the network. Anywhere from 10 to 20 a month would contact them to drop from the network. Since July 1st, not one single dentist has dropped from the network. Instead, Cigna has taken a list of the top 100 dentists in the that are utilized by our members that are not in network, and they are literally knocking on doors and going into the offices with them in order to get them to negotiate contracts with them. So far, roughly 20 dentists out of that top 100 list of non-network dentists have joined the network. So we're starting to see that network continuously increase. We're continuing to monitor that though. We want to make sure that members have access to dentists. In some areas, we understand that you might not have the ability to access a dentist in network, and we might not have the same amount as, we'll call it pull, in order to get the dentist to enroll in network. So if you live in a rural area and you don't have access to at least 2 dentists within a 15-mile radius of your home, you're not going to experience those lower out-of-network benefits. Instead, you can contact Cigna and they'll be sure that your benefits are paid in full. For those of us that are in Connecticut for the most part, but in an area where we're able to access care, we continue to grow that network and to monitor those out-of-network services. We don't want this to be a a detriment to our members to access care or to continue their care, we want to make sure that dentists are joining the network. And we've actually increased the benefit for in-network services on both our basic and enhanced plans to really drive folks to understand seeing an in-network benefit or provider is the best level of benefit care you can get. If you have any questions or concerns about finding a dentist in your area or whether or not your dentist is in network, I will plug in the Cigna number in the chat box here. Also know if you have a dentist that you really, really love and to date they're not in network, you can nominate that dentist. What that means is you can contact Cigna and tell them, I want you to contact Dr. Smith. And they will reach out to Dr. Smith and let them know that a state of Connecticut member really wants them to join the plan and hopefully start the negotiations to bring them in network for you. And Megan, if there are no providers within 15 miles of your home, you have received a letter. It likely doesn't apply. It doesn't apply to many of us. There are, I think, about 200 members that applied to, but a letter was sent directly to the homes of those individuals that it does apply to with instructions as to how to handle that. It's very likely that you do have dentists available to you. And again, if you reach out to Cigna, they can help you get a list of those dentists, or you can visit the My Cigna site and search their directory as well.
I had a question. Oh, I'm sorry, Bernadette, go ahead.
Sorry, I was going to ask if foot levelers and compression socks covered.
Compression stockings, yes, are covered. I'm not familiar with foot levelers. I'm not sure if that's referring to orthotics or there's another benefit there, so I wouldn't be able to answer that one, but member services could provide more information.
And people had questions about the Caremark accounts. Is it going, because people are going to have to set up an account, and is there going to be step-by-step instructions that are sent out to everybody so it's very simple and they know what to do?
Yeah, so to set up a caremark.com account, again, that'll be the secure member website on the pharmacy side. When you get your new ID card, it'll come in a welcome kit. That will provide more information on how you can set up that account.
And I just want to remind everyone to submit their Part B and D if you're being charged anything above $202.90 or below, because there's a question in the chat. Medicaid has gone down if you're paying anything under $202.90. If you're on Medicaid, you also have to submit to the same address, which is in the chat. So whether it's above or below, it needs to be submitted.
That's a great call out, Bernadette. We are seeing that some members are having a decrease. Unfortunately, we have tried so many times to have a communication path established with Medicare that they will share the information with us. They're just not willing to do so. So we do ask that you update us annually if you're not paying that standard rate. And because I know that was at the top of the box earlier, I'm going to repost that contact information for the Medicare reimbursements in the chat now.
Yeah, I added my contact information in the chat too. I hope everybody has that. My phone number at the Union Hall, for those who have called in and can't see the screen, my number is 860-951-6614, and my extension is 118, and that'll get you right to my desk at the Union Hall. And if you are running into an issue that maybe wasn't addressed tonight or a specific issue, just reach out to me and we'll see what we can do to help.
Kevin has direct access to me for any inquiries that need research on our side. So our team is always willing and able to research anything that needs additional help. So we are here to support you.
Yes, I see that Walter Young says his wife had carpal tunnel surgery in 2024, and the doctor informed them that Aetna is refusing to pay the bill. What should his next option be?
I actually wrote that down. I will take that back and research that. Then there was a question just below that related to a wheelchair. So I'll take both of those items back to our team and we'll be in touch.
Wonderful. And you have both of the names of the retirees?
I do.
Okay,
I do. Yes.
thank you.
I saw that there was a question or two with regard to vision coverage. And that's the one point of bad news I think I have is that there's no increase or additional benefit to our vision coverage as of yet. I am with you folks. I am blind as a bat. If I don't have my contact lenses in, I am walking into walls. That would be a benefit that could potentially be negotiated into the contracts for us. It has not been as of yet. There would be a cost associated with it. So that would definitely be something that I know a lot of members would be interested in, but unfortunately, it just isn't part of our plan as of yet. Now, keep in mind, if you have a medical condition of any sort related to your eyes, that's always going to be covered. And you do have one eye exam covered once per year. It's just strictly the hardware and contact lenses that are not covered. If you do have cataract surgery, you can have one pair of basic glasses provided to you after cataract surgery.
And there's a lot of information that we're discussing tonight pretty quickly. So I just want to let everybody know that if you'd like to watch this over, we are now recording all of our quarterly virtual meetings and we're posting them on our website. Our website is www.csea-ct.com. And if you go to our website and you go to, oh, I have to look and see. I think it's under benefits. It might be under Council 400. I'll look it up and get that information to everybody before this meeting is over. So you can go and rewatch it. If a subject went by too quick and you didn't get the information you need, you can always rewatch it. And someone has a question, if they're using CVS Specialty Pharmacy for a medication, will they need to do anything different to sign up, or will things automatically be delivered?
So it will, if you're using specialty medication, your ID information will carry over. You'll still need to, if it's a medication that you actively order when you need it, you'll still need to continue to do that. But generally speaking, that information will carry over.
There are a couple of questions that have been posted with regard to the flight program. There is no change to the flight program for 2026 that will continue to be offered to our members. For those of you that aren't aware of the flight program, it is a medical weight loss program that we offer our members. You work with doctors virtually to monitor your weight loss and as needed to obtain prescriptions for those concerns as well. And Michael O'Brien, I probably shouldn't have mentioned just tropical areas when traveling out of the country. You're welcome to take us to Europe as well, or anywhere out of the country. The same rules apply for any traveling outside of the country. Services are available for urgent and emergent care.
There was a question about the Access to Care Rides program. Is that going to continue starting January 1st?
Yes, so Access to Care actually has a new name. So their new name is called MTM Health, but it is the same vendor, just a different name. They provide non-emergency transportation. So everyone has access to this benefit. It's a benefit that I'm trying to think of the best way to explain it. You don't need to have a medical need. This isn't a medically necessary transport. This is non-emergency transportation. So perhaps you don't like to drive, or you can't drive, or you don't like the parking lot at a particular facility. Everyone has access to this benefit. So it provides you with 24 one-way trips per year, up to 60 miles per trip. So if you need a ride both to and from the doctor's appointment, that counts as 2 trips. If you just need someone to drop you off and you have someone else that can pick you up, then you can pick and choose whether you use 1 or 2 trips. So yes, that is still a covered benefit. The only difference is that the vendor's name has now changed to MTM Health.
And actually, staying on that same sort of arena of conversation, Kristen, can you talk about the food delivery as well?
Yes, so the food delivery program is for post-discharge from an inpatient stay. So if you're in an inpatient acute hospital or inpatient mental health or rehab, then you would qualify for the meal benefit, the meal delivery benefit. We work with Nations Market for this benefit. After you return from the hospital or whichever inpatient facility you're in, you'll get a phone call confirming the delivery. So of course you're welcome to opt out, but this is a free benefit. We certainly encourage that everyone take advantage of it if you're eligible. For this benefit, you have access to um, 28 meals total. So it's 14 days, 2 meals a day. And again, once you get home from that inpatient stay, they'll call you to coordinate that delivery. You do have the option, because it's so many meals, you do have the option to do 2 separate deliveries if you don't have room in your fridge to store all of those meals. But they are fresh meals, they are not frozen. Can't promise that they'll cater to all of your taste preferences, but if you have dietary restrictions, they can accommodate whatever you may need. So again, that benefit is for those that are coming home from an inpatient stay. Clarification on the transportation benefit. Someone asked if they're available outside of Connecticut. Absolutely. That is a national benefit. So you can be living in Connecticut and visiting a provider in Massachusetts. As long as it's within that 60-mile radius, that would be covered. Or you can be living in Florida or California, or whatever the case is, that benefit is covered anywhere in the US.
A member told me at a meeting today that that someone was charged for a ride, or I didn't write down what happened, but has there been problems with rides? Are you aware of anything like that? And
I'm not
if someone runs into an issue, do they call that same number to report it?
I'm not aware of any issues. You absolutely should not be charged for that benefit. So if that has happened, give us a call at the number on the back of your ID card, or Bernadette, if you have the details, feel free to send it to me and we can look into that. No one should be charged for that transportation benefit.
Okay. And I'd like to just remind everyone also that the food and the ride benefits, they're not negotiated through the contract benefit. So CBAC did not negotiate these. These are something that Aetna provides at no cost as an extra bonus or benefit, which is a really nice thing to try to take advantage of. SilverScript also. Um, so these are things you can take advantage of if you're having issues with it. Always please let us know, but it's not something that we have a lot of control over because it's not a negotiated benefit. It's something that Aetna has added to this contract.
That's a great call out, Bernadette. It's the advantage to Medicare Advantage, so to speak. Now, Ruth, I don't know that I would advise not purchasing travel insurance. If you're not certain about or you're concerned about the care outside of the country, I find it just the good cost for peace of mind, because the services that are offered and available outside of the country are for urgent and emergent care only. If you were to need to seek care for something that wasn't urgent, that wouldn't be covered. Additionally, transportation back to the US wouldn't necessarily be covered as well. So if you're nervous about that, your best bet is just to pick up the travel insurance itself. Like I said, it pays for itself in just the cost of ease of mind.
Well, it's just about 5 o'clock. I don't know if there's more questions from folks, but if you haven't gotten your question answered, please reach out to me, reach out to Bernadette. We will do our best to get it over to Kristen and Ray Ellen. I just want to really thank you both for showing up tonight, for being here for our retirees. There are so many concerns and questions about this small change, and I think you put a lot of our minds at ease over this transition. So appreciate it.
Thanks
Well,
for
thanks
inviting
so much
us.
for having us. And everyone have a happy, healthy holiday season. I can't believe it's already here, but thank you.
We wish you the same. Thank you again.
Thank you.
And let
Have a
me
great night.
let everybody know that I put the website in the chat, and you go to www.csea-ct.com, look for member resources, click on that, then click on state retirees, and then click on quarterly virtual meetings. We have this that will be there in the next few days. Give us a little time to to get it online, but we have past quarterly virtual meetings on there as well. Oh, we do have one. We'll take. Can you take this one question?
Patricia, you had a question?
Oh, I was just saying thank you for the advice that you gave us. That's it.
Okay,
Thank
that's a
you.
great way to end it.
It is. Thank you very much. And I hope everybody has a wonderful holiday. Thank you again.
Take care,
Thank
everybody.
you.